You sit through your whitening appointment. Your smile looks great, and then you sip cold water. Suddenly, a sharp electric jolt shoots straight through your front teeth. Dentists clinically call this sudden pain a zinger. That sharp reaction happens because of how whitening gels actually work. The active ingredients, usually hydrogen peroxide or carbamide peroxide, are designed to oxidize and break down dark stain molecules trapped inside your enamel. But as they clear away the stains, they also alter the surface structure of the tooth. At a microscopic level, as the peroxide dissolves surface stains, it simultaneously forces open tiny vertical channels deep into the enamel layer. Cold liquids can now travel right down these exposed pathways, directly stimulating the central nerve and causing that sudden spike of pain. Because this sensitivity is a mechanical reaction to an open physical pathway, it follows a predictable pattern. That means you can systematically block the nerve and prevent the pain, rather than just hoping you can endure it. Preventing that pain starts well before you sit in the dentist's chair. Step 1 is to pre-treat your teeth for 1 to 2 weeks prior to your appointment. By brushing twice daily with a desensitizing toothpaste containing potassium nitrate, active chemical particles reach the exposed nerve endings and form the protective shield. This requires days of consistent application to build a thick enough barrier to block nerve signals at their source. Step 2 happens during your initial consultation. Ask your dentist for a lower peroxide concentration. A slower, gentler course spread over more sessions often achieves the exact same shade of white with a fraction of the physical irritation. Combining a pre-built chemical nerve block with a lower strength bleach stops the pain cycle early. You are stopping the nerve from ever firing in the first place. The next line of defense happens exactly when your session ends. Step 3 is to always request a desensitizing or fluoride gel application from your dentist before you leave the clinic. This instantly counteracts the peroxide's effects by plugging and sealing the microscopic gaps at the surface of your enamel, closing off those open channels to the outside air. Step 7 on our list applies if you are doing a multi-day treatment. If discomfort begins to build mid-course, you need to space out your sessions. Switching from daily applications to every other day reduces the immediate stress on your enamel. Stubbornly pushing through the pain limits overall results. Lowering the frequency of your applications gives teeth necessary time to repair their internal moisture balance. Controlling how long the bleach stays on your teeth and instantly repairing the outer barrier are your best methods for a fast, comfortable recovery. Even with perfect prep, people often make one critical mistake, confusing an expected biological reaction with a true dental emergency. This table breaks down what you should actually look for. Normal sensitivity includes brief zingers, mild gum tenderness, and a reaction triggered by cold air. These symptoms will naturally fade in 2 to 4 days. You need to watch out for warming signs, constant throbbing with no clear trigger, blistering white patches, or pain sharp enough to disrupt your sleep. Continuing to whiten when you have these severe symptoms is dangerous. That kind of intense pain often points to untreated cavities or a cracked tooth, and adding bleach will only make the structural damage worse. Assuming your symptoms are normal, you enter the crucial 48-hour window. Step 4 is completely avoiding extreme food and drink temperatures. During these first 2 days, the bleaching process leaves your enamel temporarily dehydrated and highly reactive. You must stick to a strictly lukewarm diet to avoid shocking the system. If you absolutely must have cold liquids, follow Step 5. Use a drinking straw. This is a simple mechanical workaround that physically bypasses your highly sensitized front teeth. And Step 6 serves as your final safety net. Taking a standard over-the-counter pain reliever like ibuprofen on day 1 will easily handle any of those lingering dull aches. Your primary job for the first 48 hours is to minimize external nerve stimulation. Give your saliva the time it needs to naturally rehydrate the tooth's internal defenses. By methodically following these steps, desensitizing beforehand, sealing the enamel immediately after, and managing your temperature exposure, you can achieve a noticeably brighter smile without the dreaded post-whitening zinger. Before you even book an appointment, look at this required checklist. Make sure you have a potassium nitrate desensitizing paste, a soft bristled brush, drinking straws, and over-the-counter pain relievers ready to go. But remember, none of these 7 steps will protect you if your teeth are already compromised. Untreated cavities, exposed roots, and active gum disease have no protective enamel layer, leaving them highly vulnerable to bleaching gel. True cosmetic enhancement means working cleanly with your body's biology, not ignoring it. Book a professional dental consultation to verify your structural health and set yourself up for a comfortable, successful treatment.